Our third speaker is Captain Marie de Perio. She is Senior Medical Advisor in the Office of the Director of CDC's National Institute for Occupational Safety and Health. And her talk will be Occupational Valley Fever.
Thank you very much for the opportunity to present here. So we've recognized for a long time that work is an important determinant of health. So back in the 5th century BC, Hippocrates said, there are many handicrafts and arts which cause those who exercise them certain pains and plagues. So coccidioidomycosis or valley fever has long been recognized as an occupationally related infectious disease. The first ever case of valley fever described was in an Argentine soldier in 1892. And some occupationally acquired cases are from accidental exposures in the laboratory, but environmental exposures are recognized to be a significant factor in transmission. So people who work outdoors and disrupt soil or work in dusty or windy conditions are thought to be at increased risk of infection. Increased disease incidence and documented outbreaks have been reported among multiple occupational groups, including agricultural, construction, archaeology, military, oil and gas workers, and more recently, wildland firefighters. So Michael Friedman and colleagues did a comprehensive review of 47 valley fever outbreaks reported worldwide that included over 1,400 cases from 1940 to 2015. And they found that over half of the outbreaks were associated with occupational exposures, most commonly associated with the military, construction, archaeology, and labs. So multiple factors may influence the potential for disease transmission in a workplace, and we often discuss them as workplace factors. So these include things like workplace characteristics, like where does the work take place in a hot, dry, windy location? Workplace practices, so do workers disrupt soil as part of their job? The work processes, so how do they dig in the soil? Do they hand dig or do they use machinery? And then what the controls are in place to minimize exposures. And then worker factors, including the individual worker's immunity and or susceptibility, play a role, as well as impaired immunity or other personal risk factors. Socioeconomic, cultural, and language factors also can play a role in disease transmission, especially with training, and these can lead to some disparities that we see among incidence rates for some infections by race, ethnicity, and socioeconomic status. So these disparities are more on an institutional level rather than on an individual level and may or may not be directly related to the work. So the risk among military personnel who are assigned to or train in endemic areas is well recognized. And it's been estimated that more than 350,000 military personnel are stationed at bases within endemic regions. Multiple outbreaks and cases have been reported dating back to World War II. And C.E. Smith did a lot of the groundbreaking work on this topic. So explanations for these high rates are thought to be related to the sort of newcomer enlistees from other parts of the country with no prior immunity, also the dusty training exercises and operations, and then also the known endemicity of the area. A 2018 military surveillance report by Williams and colleagues identified 574 incident cases among active component service members over a 10-year period. So the most common locations were California and Arizona, which is to be expected. They calculated an overall crude incidence rate of 3.9 cases per 100,000 person years and found that the highest rates occurred among those 40 years and older, Navy members, enlisted members, and Asian and Pacific Islanders. In terms of occupation, rates were highest among healthcare personnel and then lowest among infantry, artillery, and combat engineering, and then also armor and motor transport. It's unclear why healthcare personnel would have higher rates. There could be some detection bias, but the authors really didn't offer hypotheses in that. So Kim Lucas discussed all of the work in California regarding valley fever among inmates, but several years ago I led an investigation of valley fever at the 2 California state prisons, Pleasant Valley and Avenal, that focused on the employees. So we cross-checked the cases reported to California as part of their state surveillance with the employee rosters for both prisons and identified 103 confirmed cases among employees over a 4.5-year period. We calculated the crude annual incidence to be over 1,000 cases per 100,000 employees in Prison A, which is Pleasant Valley, and then 511 cases per 100,000 employees for Prison B, which is Avenal. We interviewed a subset of workers at the prisons and found that employees are potentially exposed to coccidioides in both the outdoor and indoor workplace and also outside of work. So about a third of the interviewed employees reported soil disruption activities, which surprised us, but they were doing jobs like digging for contraband. So these are correctional officers that are looking for concealed weapons in the soil. In these photos of the prison grounds, you can see that they're really located in these arid areas that are underdeveloped. So in the construction industry, we've also seen outbreaks of valley fever among workers constructing solar farms. So the construction of these large-scale facilities occurs in these low-population rural areas and often requires recruiting skilled laborers from outside the county or the state. So the work involves leveling the ground, digging trenches for underground electric cables, performing the electrical work in the trenches, and then driving piles to install panel rigs, and then also digging manually or by machine. So an outbreak reported by Jason Wilkin and colleagues out of California identified 44 cases among employees at 2 solar farms in San Luis Obispo County. And they found this by comparing state-based case surveillance with employee rosters. So of note, 9 workers were hospitalized, 2 had disseminated disease, and 34 missed work. The most common occupations of these cases were electrician and heavy equipment operator. And then 58% of the cases reported frequent soil disrupting activities. So the median hours worked outdoors was 10 hours per day. And of note, only 6 of the patients reported frequently using respiratory protection. And then Gail Sondermeyer and colleagues then did a follow-on case control study in December 2014. And in this study, they compared 89 workers with clinical valley fever to 325 asymptomatic workers. And the risk factors included active digging, working in a ditch or trench, and then operating heavy machinery, with frequently being in a dust cloud or storm as being independently a risk factor. An independent protective factor was reported to be frequently wetting the soil before activity. And then a more recent, another outbreak that Rebecca Laws and colleagues investigated identified 9 cases among over 2,400 employees at a solar farm in 2016 and 2017. The incidence rate calculated there was about 1,000 cases per 100,000 person years. So an occupational group that has emerged more recently as at risk are wildland firefighters. And Gail mentioned them in the Q&A session of her talk, but wildland firefighting often involves cutting or what they call digging fire containment lines around the perimeter, which is just basically clearing the area of vegetation so you can stop the fire. So firefighters clear and remove the vegetation down to the bare soil, and they can use things like chainsaws and also hand tools. So an outbreak was reported among inmate wildland firefighters in California in 2017, and this group was part of a pre-release program and had responded to a 4-day wildfire by serving as hand crews. So in this outbreak, 10 case patients were identified and 2 were hospitalized. And the risk factors identified included cutting fire lines with an axe tool and then also being in a dust cloud or storm. And then few of the cases reported training and none reported wearing respiratory protection. So another outbreak among wildland firefighters in 2021, also in California, was recently reported in the MMWR. And this outbreak saw 3 confirmed cases, including 2 who were hospitalized, and the work involved digging trenches and then mopping up fire with heavy dust exposure without respiratory protection. So notably, the crew had all been fit tested for respirators and also had training to minimize dust exposures. So these investigations really identified challenges in making recommendations, especially for those hand crews that don't have the option to use heavy machinery, and also the extremely dusty conditions of their locations. So also respiratory protection recommendations are really limited by the concerns about flammability and heat stress for this occupational group. So the last occupational group I wanted to discuss are farm workers. There have been some really interesting papers on valley fever and farm workers, and Dr. Taylor presented one of them. He also presented some really interesting findings about agricultural versus non-agricultural land. But the first is a case control study led by Steve McCurdy of Hispanic farm workers in Kern County. He compared 110 cases with positive serology to 93 controls with multiple negative serologies. And this group found that the self-reported dust exposure nearly doubled the odds of being infected, while working with root or bulb vegetable crops tripled the odds. So I had to look up what those are. So these types of crops include beets, carrots, garlic, onions, and radishes, and sweet potatoes. So basically things that grow in the ground. Interestingly, a protective factor was found to be leaf removal, which is typically involved in cultivating grapes and doesn't involve soil disruption. And of note, the cases reported a median of 18 days of lost work time. And then a group led by Carol Sepan conducted a knowledge, attitudes, beliefs, and behavior, or KAB survey of 119 farm workers in Kern County in 2017. They found that 73% of participants were aware of valley fever. However, common misconceptions included that valley fever is associated with pesticide exposure or contaminated food or water, causes GI symptoms, is transmissible person to person, and then also is prevented by bandana masks. And some of the concerns that came out of these interviews were really about the inability to take off of work when ill and the lack of health insurance. So participants were asked about their preferred source of health information, and interestingly, the top three were TV, a family friend or coworker, and then a physician or healthcare provider, and the internet was super far down on the list. So it's estimated that there are over 800,000 hired agricultural workers in California. So this work really highlights the disparities that we see with valley fever in terms of the intersection between demographics and work. So in occupational safety and health, we use the hierarchy of controls as an approach to prevent exposures in the workplace. So this prioritizes measures in order of the most effective, so elimination and substitution, to the least effective, which is personal protective equipment or PPE. So since elimination and substitution are difficult to achieve with valley fever, we start with engineering controls. So these include dust suppression methods like wetting the soil, stabilizing disturbed soil using soil binders, and then also covering excavated soil. Other methods can include reducing grading and the need for trenching, and then use heavy equipment with enclosed cabs and HEPA filters, and also plant vegetation, trees, lawn, which I think we all acknowledge is very difficult during times of drought in deserts. So in terms of administrative controls, it's important for employers to provide training to employees on ways to reduce their exposure, how to recognize symptoms, and where to seek care. In fact, Gail mentioned this, the California Assembly Bill AB 203 requires construction employers performing soil disruption work in endemic areas to provide training, but note that this bill does not cover agricultural or other workers. Consideration can also be made to implement criteria for suspending work based on wind or dust conditions. And then it's also important for workers to try and stay upwind of any digging or dumping soil, drilling or blasting as much as possible. And then practical things like keeping your windows closed and using air conditioning on recirculate may help. So PPE recommendations include implementing a respiratory protection program for workers who are exposed to dust during their jobs. An OSHA-compliant program includes medical clearance, training, and fit testing. So consideration can be made to using NIOSH-approved respirators at least as protective as N95s when conducting soil disturbing work or during high winds or when working in trenches. And other PPE that could be used include coveralls and dedicated work boots to reduce tracking dirt and dust into private vehicles or homes. So I wanted to conclude by saying valley fever is a significant occupational infectious disease, but I wanted to end this presentation with some knowledge gaps to hopefully set the stage for tomorrow. So first, we still don't have a great understanding of the occupational burden of valley fever, and it's important that we improve surveillance by routinely collecting occupation and industry. So this will help us better identify groups of workers at high risk, identify and set research priorities, and then develop and implement prevention strategies. And I'm super excited to hear about the enhanced surveillance that CDC, that our mycotic disease colleagues and then our California partners are trying to do. We are underestimating the true burden of the disease because our existing data sources are not comprehensive. So we've had to use a combination of case report forms and their databases, employee rosters, employer records, and then also workers' compensation claims. Another gap in our knowledge is what the role of air and soil sampling are in assessing and mitigating valley fever risk. Is there a role for skin testing similar to what's been done among inmates in California? We're still learning about the test characteristics like sensitivity and specificity. It's also important to better understand the effectiveness of the interventions to minimize exposures. So things like environmental mitigation, like do soil stabilizers actually work? What's the effectiveness of different types of respiratory protection on preventing exposure and infection? And then finally, how might we use wind speed, dust levels, and other metrics as triggers for potentially temporarily stopping work or increasing control measures in the workplace? And so in the interest of time, this is just my summary slide, and I will turn it back to Dr. Galgiani.
Thank you so much.